Hello, guys, and thank you, Professor Yehuda Shoenfeld, for joining us. As a small introduction, he is the specialist of internal medicine and world-famous immunologist. He's also the head of the autoimmune center at the Sheba Medical Center of the Tel Aviv University, head of autoimmune disease research at the Tel Aviv University, chief advisor on immunology for the Israeli Armed Forces, and he has, until this point, published more than 2,300 scientific publications and wrote over 45 books. Thank you, dear Professor Yehuda Shoenfeld, for joining us.
My pleasure.
People believe that in the case of autoimmune disorders, our immune system is confused. Specialists, doctors, pretty much almost believe that it's bad luck and it's just happening like this. And it's just attacking our own organs. According to your top and long expertise and experience, is this true, or how do you see it, Professor?
So we have an immune system which the function and the role of this immune system is to prevent foreign invaders to our body, like viruses or bacteria. And the immune system is doing it very well. When there is autoimmune diseases, which are diseases in which the immune system turns to our body, against our organs, the immune system is confused. It's correct, but it is done in specific people who are genetically determined. So not everybody would develop autoimmune diseases. The incidence is between 5%. We know who are these people who are genetically determined or are at risk of developing autoimmune disease because we can find in their family first-degree relatives which suffer also from autoimmune diseases. These people have a very efficient, aggressive, beneficial immune system. Therefore, they have advantage in evolution because they can fight better bacteria, viruses, etc. However, if these people who are at risk meet in the daily life something which strongly stimulates the immune system, it brings the immune system into chaos, what the people believe is called confusion, and redirect the immune reaction against foreign invaders, against our own constituents. These subjects are well known. They have genetic markers, they have specific genes. We can detect them by blood test, which is called HLA. It's the same blood test that we do to determine fatherhood when the father rejects the idea that he is the father. So basically, autoimmune diseases are genetically determined, and they emerge upon a stimulation from the environment. And now you want to ask me what kind of stimulation from the environment we know. Ask the question.
Also, beside this question, how much the environment and cause impact us? Is it more the genetic part or the predisposition, or is also the environmental causes?
The question, but despite that you are very nice, I will answer you. There is no percentage what is more important. You need both things. You need the genetic to be born to the proper father and mother, and you need the environmental factor. Examples of environmental factor which can stimulate the immune system and lead to the chaos. We found infectious agents like the virus of kissing disease, infectious mononucleosis. The virus name is EB virus, which is responsible for induction of 30 autoimmune diseases. But recently, we faced a stronger inducer of autoimmune diseases, and this is the COVID-19, the coronavirus, which can induce and induced in the past many autoimmune diseases because it is one of the strongest stimulator of the immune system. Now, you want to ask me why 83% of the patients with autoimmune diseases are female at the childbearing ages. So my answer is that female have a more aggressive, good, beneficial immune system than men, because females are more important in the evolution. They are incubators, and this is the reason why women outlast men. As I tell my wife, when I will die soon, you will be able to marry 2 Russian oligarchs. So this actually was exemplified in the COVID-19, in the corona pandemic. Only 40% of the deaths were women, but 60% were men. So the women, like the genetically prone people to autoimmunity, they have a better immune system. Then they can fight better viruses and bacteria, but they are more prone to develop autoimmune disease because the stimulation induces chaos. But it's not only infectious agents. We have a series of materials in our environment which are named adjuvants. Adjuvants come from the word adjuvare, to help, to stimulate. Like, for instance, the aluminum in the adjuvants of vaccines. Therefore, potentially also vaccine can induce autoimmune diseases. We have seen it also in the vaccine against corona. It also induced autoimmune diseases. But there are additional factors like stress or even the exposure to sun. The sun, S-U-N, can induce, for instance, lupus. So we have a series factors in the environment which can join the genetic preponderance to induce in a specific individual, especially women at the childbearing ages, to induce the emergence of autoimmune disease.
If we talk about the sun, is it correct for us to say that because of our modern urban lifestyle and lack of maybe vitamins D and other vitamins, we have problems with the sun? Or is this an old problem and people didn't know of?
No, you are a very clever introducer, and you ask a very clever questions. It's true because in our lifestyle, we are not exposed to the sun cannot induce vitamin D. It is true that low levels of vitamin D are associated, they are a factor in induction of autoimmune diseases. Moreover, supplement of vitamin D can ameliorate symptoms of autoimmune diseases. Myself, I take every day 2,000 international units of vitamin D because I don't want to have autoimmune disease, despite the fact that you can see that I'm a man and not a woman at the childbearing ages. But also, this vitamin D has almost no side effects, and it has many beneficial effects. So it's true that on the one hand, sun can induce autoimmunity in a different mechanism. On the other hand, exposure to sun may lead to increased vitamin D levels and to prevent autoimmune diseases. This is the reason why when you go to the North Pole or to the South Pole, you have increased autoimmune diseases, while in the equator, you have less autoimmune diseases. But in the North and the South, there are industrial societies, and therefore also pollution is one of the factors that can induce stimulation of the immune system and induce autoimmunity.
If we talk about more than 80% of people with autoimmune diseases being women, like you said, Professor, are women more exposed than men to different environmental causes, like, for instance, breast implants or loads of chemicals that they use, makeup, beauty, cosmetics, and so on, absorbents, early contraceptive pills, or it's just like that, they're women and they have to have more autoimmune diseases?
Again, your question is very clever and leads to additional environmental factor. Since 100 years, women go to be transplanted in their chest, in their breast, with silicone implants. This was a medical mistake because in the past they believed that the silicone is inert to the immune system, which means does not react with the immune system. But it has been found that the silicone reacts like adjuvants. It stimulates the immune system. Moreover, it is staying in our body for many years, more than even recommended by the plastic surgeons. And moreover, these silicone implants, by and large, are transplanted to young women. So we have a combination of an adjuvant which stays in your body for a long time, stimulate the immune system in women, young women, who may have a very strong immune system, and this leads to the chaos and to a generation of classical autoimmune diseases and also a novel syndrome which involves an autoimmunity of the autonomic nervous system. The autonomic nervous system is not under our control. When I put my finger on the nose, I wanted to put the finger on the nose. But when I eat and I need saliva, this is done automatically by the autonomic nervous system. The autonomic nervous system has two arms to have the balance, one which stimulates and one which returns back the balance. in silicone implants, but also in patients with chronic fatigue syndrome and fibromyalgia and post-COVID syndrome. There is stimulation of the immune system and generation of autoantibodies, missile against our own body, against the autonomic nervous system. And therefore, we have complaints like cognitive impairment. A woman put the keys of the car in the refrigerator. Memory loss, sleeping disturbances, severe fatigue, widespread pains like fibromyalgia, difficulties in producing saliva, dry mouth and dry eyes, pains and paresthesia in our hands and legs. All of those are explained by this autoimmunity against the autonomic nervous system. It can be induced by virus, like the COVID. It can be induced by silicone, like in the breast silicone implants. Therefore, the absolute recommendation is to explant, to take out the silicone implants. In more than 80% of 300 women with silicone implants that I have examined, by taking out the silicone, all the complaints disappeared.
Wow, a lot of women in Romania have this problem and have breast implants. Interesting. You take it out and everything solves. We Romanians have a lot of close connections with grandparents, grandmas that come obviously from the rural side. We don't see that much of diagnosis like autoimmune diseases for our grandparents, grandmas. Is this a new thing, or it was an old situation but people weren't aware of?
Again, a very important and clever question, Sorin. The autoimmune field lagged behind cardiology and oncology, cancer research, etc. It is a relatively young field because in the past, the famous immunologists did not believe that there is a possibility that the immune system will be redirected against your own body. They believe that if it happens, you die. But that's not true. We have more than 100 different diseases of autoimmune system. In the brain, multiple sclerosis. In the skin, pemphigus vulgaris. In the systems, different systems like lupus, therefore it is called systemic lupus erythematosus. It is a field that in the last 30 years, many of the Nobel prizes were given to better understanding of the immune system and autoimmunity. Therefore, Romanian physicians have to catch up and to learn, to study, to come to congresses in which we discuss autoimmune diseases. They do come to the congresses. I know several Romanian physicians. The next international congress, which I organized, will take place in Ljubljana in Slovenia in next May, the month May. And I hope to see at least 1,000 physicians from Romania attending this meeting.
Good, good. What would be, Professor, your advice to young doctors from Romania and other countries as well. Where since there is a lot of information, maybe too much, some specialists would say, what would be your just plain simple advice for them?
To read, and to read. You can do it by entering the websites. We have an autoimmunity network. Every Friday at 7:30 in the morning, Israel time, every week for the last 136 weeks, we have a webinar for 1 hour and a half, in which there are at least 7 to 8 presentations. If they will write to me, we will invite them free of charge. We also serve coffee via the Zoom if they want. This is one possibility. The second is to attend congresses of autoimmunity. And the third, if they want to allow me to build a new veranda in my apartment, they could buy one of my books, including a very famous textbook called Mosaic of Autoimmunity. And then I will be happy and they will be happy because they will expand their knowledge in autoimmunity.
Where would our doctors find you? To send you an email or contact something?
There is no problem because my email appears in the website, in the literature, in the papers, etc. So I don't think that there is any problem to find me. If my wife found me, they will be able to find me.
Good to know. Professor, what about depression? How do you see it? And is this somehow related to autoimmune disorders?
It's also a very interesting question. On one hand, depression, like stress, can be one of the factors which may lead to autoimmune diseases. On the other hand, many autoimmune diseases may be associated with depression, like, for instance, in lupus, but as chronic diseases, which unfortunately we don't have a cure for most of them. We can suppress the disease, we can induce remission for sometime long time. As a chronic disease, usually it may be associated with depression. Therefore, our aim is always to achieve remission as quickly in all autoimmune diseases. Sometimes we need also the help of the psychiatrist or psychologist to help us also with the approach to somebody in which the depression is a major factor.
Okay, one maybe ridiculous question. How come my parents didn't have autoimmune diseases and their children get it? How come this happens and we can say it's genetic?
That's again a very interesting question. If you want to specialize in autoimmunity, approach me and I will allow you to specialize. So, first of all, the fact that the parents do not have autoimmune diseases, it might be that they do, but they were not recognized. For instance, there is a skin disease called psoriasis. They may have psoriasis, but they don't know that it is autoimmune in nature. Another disease, vitiligo, which is white patches, very similar to what the famous dancer and singer had. It's an autoimmune in nature. So that's one aspect. The second aspect to your question it might be that you, the parents or grandparents, lived in a rural environment. They were farmers, they were more relaxed, etc. While their grandchildren live in Bucharest and they are exposed to the traffic and to the stress of their bosses, etc. So there is a change, first of all, in knowledge, and there is a change in exposure to different factors. For instance, to some viruses. Sometimes it is exposure to many vaccines and so forth.
If someone receives the diagnostic of autoimmune disease and the specialist tells them, like at some point actually told me, here you are, this is an autoimmune disease, this will just get worse and worse, take this chemical pills all your life. So what does the patient next? Depression, insomnia, and other many problems. First of all, I guess because of the fear and the echo voice of the doctors. What should this patient do with his lifestyle, and if there is any hope?
First of all, change your doctor to a more optimistic doctor. Number two, there is a revolution in our understanding of autoimmunity, and we have better and better drugs. For instance, we have today biological therapies. They are expensive, but they can induce remission for a long time. Number three, try to conduct a healthy way of life. Be involved in exercise. The best exercise is swimming. Take vacations to avoid too much exposure to your bosses. Take vitamin D, which is very important, 2,000 international units. You can take also multivitamin, which is not bad either. So as you can see, we have different measurements to increase your better life, to induce a long remission. And as I say to my patients, if I will be able to keep you in remission until the age of 96, it's like a cure. And the research in autoimmunity continues and continues. And we develop better drugs, better diagnostic abilities, and the future is more velvet than black.
That's beautiful. That's good to know. What about our microbiome, gut flora? Is this correlated with the autoimmune disease, since most specialists in Romania don't mention it, no information about it? What is your opinion, Professor?
So first of all, my opinion is that you will interview most specialists in Romania and teach them that the microbiome is very important. Microbiome involves what you eat, especially, and what you get from the environment. But what you eat is very important. And therefore, one of the recommendations to patients with autoimmune diseases is to have a balanced diet. The best diet is vegetarian. When I say vegetarian, it doesn't mean to say that you have to avoid completely meat. Once in a while, you can eat and also enjoy life. So keep a very balanced diet. You can measure your microbiome. Sometimes it helps to change or to use some specific antibiotics, but that's not recommended to do with Romanian physicians who do not recognize the importance of the microbiome.
Yes, this is very true. I think, if not, I'm not mistaken, Romania is the first country in Europe regarding our specialists, medical doctors, recommending antibiotics. They just, like candy, they just recommend it, and very few times recommend probiotics. And the patient feels very tired, very sick, and at some point it gives up, Or there is a scenario that the doctors say, okay, your analysis look better. You don't have this problem that you came to us. But still the patient feels fatigue, maybe depressed, bad feelings all around. What should the patient do in this situation?
So if you need to take antibiotics, take antibiotics. If you don't need, don't take antibiotics. Okay?
Yeah.
So that's the recommendation. So I thank you very much for your wonderful interview. And you can also thank me for the wonderful interview.
Thank you,
Because
Professor.
if I will continue, I will miss my flight back from Riga in Latvia to Tel Aviv. So it was a great pleasure to have really a very clever interviewer like you. And maybe in the future we will meet again, maybe in Bucharest, where I have visited in the past. So good luck and a lot of health, dear Sorin Gadol.
Thank you. And if you come to Romania, please inform me. I will be more than honored to meet you, Professor. Thank you again, and have a beautiful flight. All the best.
Thank you very much. Bye-bye.
Bye-bye.